Roy Barsness, welcome to the show.
Thank you. Good to be here.
Like we were just talking about before I pressed record, the lecture series that you recorded alongside the book, The Core Competencies, so informative and so good. And there was something I wanted to mention to you, but then I thought it would be good just to press play and tell you on the show. The
Yeah.
intro and outro to those lectures is such a beautiful melody, the
Mm.
piano.
Mm.
Where is that from? That's lovely.
That's a good question. I don't know. I had one of my students who's is acquainted with all the things that podcasters must do that, and he sent me that as how do you think about this? And I think it's great, but I can't tell you who it is or where it's from. I'm sorry, but I'll find out for you.
I think I'll just have to
Yeah.
keep listening to the lecture series.
There you go. I won't send it right away.
Exactly, exactly. Well, like I said to you before we started, Roy, this I have it right here, this book, The Core Competencies of Relational Psychoanalysis. It's fantastic. Thank you so much, honestly.
Mm.
Really, really helpful. It was actually my supervisor that got me onto it. I've come across your research in my master's, actually, when I was writing an annotated bibliography about Gestalt therapy. And obviously, there's a lot of similarities.
Mm.
Some distinctions too, of course. And then, yeah, speaking to my supervisor, Tom, he said, "Do you know that Roy's got a book out?" And I said, "No."
Mm.
And I just couldn't put it down. It was really, really awesome. So I wanted to begin actually by talking about the research methodology, if you don't mind, because that was quite interesting. It sounds to me like you had a lot of data, and then to sort of compile it and really only keep the seven or the eight, and obviously including love competencies would have been pretty difficult, I imagine. You would have been sort of shaving away your loved ones almost in a sense.
Yeah. Yeah, no, it was quite a deal actually. And um, it was a qualitative study. And those are, I always tell doctoral students, be careful when you say you want to do a qualitative study, because at the onset it looks like, oh, just interview people. But no, go ahead, get out of your dissertation and do qualitative the rest of your life. But quantitative is the easier one route to go, even if the results are not that great. But what happened, I think it's a natural. So I did a qualitative study, and what that involved is interviewing. What you do is you interview people until there's no more new data coming up. And so, I chose to direct, and it's really important when doing qualitative work to zone in, to dive in, do a deep dive rather than a general kind of idea. So I'm a relational psychoanalytic psychologist, and I'm pretty high on it actually, and believe that it's actually the most natural
Mm.
treatment that is should be out there. But so anyway, my position was I'm going to research what does a psychoanalytic analyst actually do. Actually, I should back up just a bit. But
Mm.
I've been a professor for like 35 years or whatever, and one of the things I required my students to do is write a North Star paper, which was why are you doing this work in the first place? And if you know what you're doing, how are you going to do it? And then the next thing I began to do is map. Students would press questions, and so like, well, how does your mind work? How does this go on in you when you work this way?
Mm.
So I began to think that's a great question, and I began to map my own mind so that when I sat with a patient, what was I pulling together? What kind of thoughts, theories, ideas from my psychoanalytic pool of thinking was I applying in the moment with my patients?
Mm.
And then I would say I got the stupid idea, but the stupid idea did end up being in the book, is to do this long time research before going ahead and publishing it. And what happened is I chose people who had been analysts, relational analysts for at least 20 years. And some of them from the beginnings in the 1980s with the movement out of NYU postdoc
Mm.
program in psychoanalysis. And you're right. The data just kept coming and coming. So then what you do is you have all this data, um, and then you begin to formulate it almost like a factor analysis, like what keeps a grouping over and over and over. And what I did is I had two students of mine assist me in the analysis. So we took all of this data and whatever words hit us, we'd circle them. They would become part of the column, if you will. And then we just slowly, bit by bit, could see the similarities and all those kinds of things that ended up then in these 7+1, you're right, um, categories. So what happens actually, I'll just make a quick mention
Of course.
about, I don't know, Brene Brown's work on vulnerability. So the qualitative tool that I used was the same as what she used to arrive at vulnerability. And in GST, um, you're to arrive at one fundamental core idea. So what happened is actually love was that core idea.
Yep.
But I thought, that's not going to fly. And then furthermore, I thought, and wait a minute, I have to break that down in a way to see, well, what are the constitutes, if you will, of love?
Mm,
When you sit with a patient, how are you sitting it in such a way where that kind of idea of love emerges and yeah, we can talk about love in a moment because certainly if I were to rewrite the book, I would make some new comments about love because uh, I think it gets mixed up in our work as a sentiment, as like in
mm,
falling in love, and as a romantic. And I'm a big Buber fanatic,
yeah.
and his whole concept is that love is not a it is a sentiment. And even what I write in the book here and had Daniel Shaw elaborate on is there is that deep sense of that kind of love. But sentimental love is messier in a way in that it's gets jealous, it does all these sorts of things. And what Buber talks about is sentiment as a presence, as a
Mm,
way of being in the world. And I saw that you wrote something, love isn't a feeling, it's a habit. And I would say I agree with that. And love is less a feeling and it's a presence.
mm.
Um, and that is the ethical dilemma, I believe, that we face as therapists. Are we fully present in our work when we're doing it? So
So many different threads that I want to
yes,
pull
I
on
know.
here. Um,
Yeah.
when I was reading about the research, I'll start with this. When I was reading about the research, and listening to how you pulled the data, and it was based on sort of, words and sort of patterns, I suppose, that you would hear from, Schaub and McWilliams, obviously various others. Um, as a relational analyst yourself, what was it like being with other relational analysts, other psychoanalysts?
hmm
What was it like to sit with someone who's trained to be so present and attuned and so on?
hmm You know what? My camera keeps fading. I'm just gonna pop it and then I'm annoyed by my own
Oh, there we go.
dimness.
Yep.
Yeah.
Beautiful.
And it kind of comes and goes, so I'll do that every now and again, basically.
Sure. It's a good metaphor for how present we are. Distance, presence.
Exactly. There you go. Right. Um, well, that's why, as I write in the book, how love came to be in the book is I discovered kind of a sense of love for my interviewees
Mm,
because what I discovered in interviewing uh, the people I interviewed is we really enjoyed it. We had a good time, and the passion for the work was present, and that passion increased my passion for it, if you will,
mm,
and that the process itself, though, just getting the interviews done took over a year, just because of schedules and what have you. But every interview I felt energized by and encouraged by the efforts, really, of deep listening trying to affectively be a part of the patient's story, the idea of letting ourselves be used and to participate in that use, to struggle with conflict and see what can emerge from the conflict, and to be courageous enough to not be an outsider, but actually a full participant in the therapeutic process. Those kinds of things are pretty remarkable. And in contrast to applied techniques, say,
Mm.
to a therapy, the application is the relationship, right? And the technique is the relationship. And so it was, yeah, it was a wonderful experience um, to participate in their enthusiasm for their work. Yeah.
Was it surprising for you to have a look at the results of this methodology? I know I'm spending a lot of time on the methodology. We can dive into the core competencies in a second, but to after you've pulled it all, you've systematized it, you've looked at it, you look at the results, you've got these 7.5. I really love as an example, so I want to call it 8, but I'll stay aligned. Is it surprising? I'll read it out just for the listeners as well. So, and like we were speaking about in the beginning, your lecture series on the core competencies is really wonderful because you actually interview the people who wrote the book
Mhm.
alongside you and to listen to them. And really, what I loved is to hear them talk about the case studies that they were writing about and to listen to the way in which their own viscera, as you often talk about, is moved just in
Mhm.
response to these conversations and these recollections of these people that they were just beautiful. Um, so we've got therapeutic intent, therapeutic stance, deep listening and affective attunement. We've got the there and then and the here and now. We've got patterning and linking. We've got repetition and working through. Personal favorite of mine, and I want to spend some time on it. We have courageous speech and disciplined spontaneity. And then we have love too. So hearing these now and then, coming to the end of your research, was any of this surprising for you, Roy? What was it like to see them?
Yeah. I don't I actually don't think they were surprising in the sense that they, in many ways, are historical, traditional psychoanalytic thoughts, like affective attunement, listening, repetition, um, the sense of collision, enactments, those kinds of things. However, and this is where the relational movement and why this book is for relational psychoanalytic theory, is all of those theories have been reimagined and are growing in their ideas. So, for example, on the chapter on conflict, historically the conflict was intrapsychic, and it
Mm,
was the struggle between id ego and superego, right? Um, that hasn't been removed or anything, but it's integrated to go. And Stephen Mitchell, who is, of course, the man behind this whole movement, um, and the two-person psychology became the contrast between traditional analytic thoughts. And I'm always careful with that because I absolutely do not want to throw the baby out with the bathwater because we wouldn't have any of this thinking if we didn't have that thinking,
sure.
right?
Yeah.
And but it really moved it into an intersubjective space,
Mm,
which by doing that, it shifts the idea, for example, of my position
mm,
in the therapeutic space, the concept of presence and of love and of my subjectivity as a part of that process shifts from being the neutral analyst interpreting your internal world.
mm,
So that's a big deal, actually. And so all of those concepts, though historically informed, have a new rhythm to them, a new vision to it, and a new demand, frankly. Definitely a new demand. I'll tell you how I got really turned on to psychoanalysis early on in my career, which I'm really glad about. But what happened is, and I write about it in the book under in the courageous speech and the erotic transference,
yes.
is um, I began to feel something almost right away in my work, and um, the projection that got into me, I realized um, was so powerful, and I became a avid fan of Melanie Klein for and thanking her for going, oh, that she made that live for me.
Mm,
Um, but it also almost killed me and it almost killed my patient because I was trying to hold it and to interpret it and to tell her something about what she was doing,
mm,
all the while deeply stirred by her projection as a communication to me. Do you feel me? Do you get me? Do I have to yell and scream for you that I have a sense of you being present here? And fortunately, in my career, that's when Christopher Bolus was beginning to say we have to become situationally ill in order to actually help our patients. And that's when the whole concept then of the movement of intersubjectivity and interpersonal work and relational work was becoming alive. And I'm going, yeah, I feel my patients. And if I remain outside of that feeling, the patient is going to be robbed of an authentic, genuine experience.
mm.
So, one of the things that happened in my supervision, for example, um, early, no, I don't know when it happened, but I remember doing traditional supervision. And then one day, I said to the supervisee, I said, so when we'd do our formulations, we'd talk, I'd give my mind about their patient, which was a silly thing to do. But we thought that I would think I would know their patient better than them. I go, who? What? No, I don't think so. Uh, so what I did, I said, okay, let's stop for a moment. When you're sitting with this patient, what are you feeling?
Mm,
And oh my God, 1,000 more things came out when we
mm,
began to then focus on, oh, in reaction, in response to this patient, there's a whole analytic, psychological, soulful thing happening, and the patient doesn't get in on it.
mm,
And I think that's not a good idea. We got to shift this up. And so I remember saying, okay, now that we're there, now we've got to find a way. How are we going to articulate that? And I remember that, and this still happens to this day when I introduce these ideas. Oh God, I'm not going to say that to my patient. And so then we have to ask who's splitting, the patient or the therapist,
yes, yes.
and how do we find our words to bring to our patients in a way that is promotes growth and development, but withholding our subjectivity from our patients. I believe, in fact, I'm presenting a paper at APA at the end of the month on this new, well, it's not a new idea, but it's forming
Mm,
on the ethical issues of non-disclosure.
brilliant,
Um, yeah,
brilliant.
so
It's
yeah.
something that I wanted to bring up because when I came along, when I started reading about that, it is actually what I would go as far as to say that what Melanie Klein did for you, Roy, you did for me. To
Oh,
so it was really important for us. So really, yeah, really honored to have you on the show and to bring words to that experience of the ethical issues about holding back, and
mhm,
to your point, and this is something that I really wanted to unpack with you actually, how ethics, the ethics of disclosure really should be seen on a sort of continuum between two negative poles of being too non-disclosive and being too disclosive, right? But could you
exactly.
speak to that? Because I'm so on this bandwagon, and I really hope that it is a change that we start to see in our field.
Hmm. Oh yeah. Phew, that it's a huge question, actually, and you'll find it in two things I'll say. One, I've written about this in my new book
Mm,
under and from interpretation into complex dialogue,
mm,
and also myself and one of my trainers in our institute are going to be presenting in March, I think, on this idea as well. Um, and I just got back this weekend from presenting at the Analytic Institute in Oklahoma,
uh,
talking about it as well. So here we go.
great.
Let me see. I'll do my best. What has happened over to me? So you heard what I just said about my supervisee and how my supervision style changed.
Yes.
And that was a long time ago. And so based on, I just keep going. And Boomer again is what is authenticity, not
Mm,
empathy? What is authenticity? And what does it mean for me to be authentic with anybody in my life? But what does it mean for me to have an authentic exchange especially if that is the primary agent of change. And one of the things I haven't said here is the their latest research after a 30-year longitudinal study is the primary change agent in any psychotherapy is the quality of the relationship between the patient and the therapist. So
Mm.
why aren't our training programs having a major focus on the development of the therapist in the therapeutic exchange? Okay,
Mm.
that's that.
Yes.
So then what happened is I keep trying to build this conversation, this complex dialogue, if you will, in my own practice over all these years. Um, and ended up in the book, the core competency book, where Brad and I talk about courageous speech, discipline, spontaneity. And then, um, gosh, a couple of years ago now, I was supervising a group, and I read about this case in the new book on the ethical issues of non-disclosure. What happened is there was five women in this group, and the presenter was presenting how this gentleman who was in a really rough marriage and where he was, I don't know the whole story, but the story that was given is there was an oppression and he was gaining some ground about making a decision that this isn't good for me to stay in a marriage where I'm always diminished and
Mm.
put down and not valued and sexually avoided.
Mm.
Um, and then he brought up to the therapist, and the way she brought it, it sounded very well. He just brought it up. He says, I have feelings for you, and I'm attracted to you. And I was shocked, but all five of the women were appalled by
Mm.
his saying that. And I said, okay, and then I was like, whoa, how am I going to work with this?
Yeah.
So I said, let's first of all go, what's so appalling? What is this about? And they said, well, he shouldn't say things like that. It's offensive. I'm going to tell him not to say things like that, et cetera, et cetera. And in my mind, I even get a little teary thinking about it. Wait a minute, this is simply, well, first of all, love and eroticism is also about energy. It's about
Mm.
movement. Here, this guy was taking a huge risk,
Yeah.
bringing his affective state. The other thing is, analytically, this is a repetition. This is something that is should be expected would show up. Um, and then the third thing is how they got caught up in what I would call an enactment of
Mm.
this is his story. He's always beaten down. He's not his love, his wish to make love and to be in love and have feelings, etc., have been rejected. And so I said, okay, so what are we going to do with this? Well, basically, they were going to tell him it's not appropriate. That's not what therapy is about. They were going to set all the boundaries
Yes.
and make sure it's all there. Um, so I said, where is this coming from? And one of the women spoke up and she was crying. She says, you know what? This is my story.
Mm.
Uh, and this is how this movement, if you will, of relational psychoanalysis grows is we understand that our own story gets enacted or
Yeah.
activate, I should say, and get caused in enactment. So we began to work, and fortunately, that it was a very successful time where they began to see that they were acting upon the patient and
Mm.
not receiving the patient. And we began to find different ways of being able to talk about that that would not be so threatening and not awfulize something that's actually quite, in my mind, beautiful at this
Mm.
point. We don't know where it's going to go, but if you withhold all that, that's when I came up with that. You know what? It is unethical. It would literally be unethical. It'd be bad service to keep that man away from that kind of conversation.
Mm.
It does not serve, what do we say in our paper about ethics? There's a line, and I don't have it in front of me, but the ethic is doing harm to a patient by not bringing ourselves honestly into that experience.
Yeah.
Um, I wanted to say one more thing about that. And so, but saying all that, also in the book, I write about four different stages or not stages, but types of disclosure. I also talk about discipline spontaneity. And, all of that could be so harmful. It's like you're sick because you're um, having feelings for me or just flouting out feelings. But no, it's how do we bring this to the patient who goes, wow. this is interesting.
Yes.
Let's talk about it.
Yes.
Um,
Yes.
and I would have to say, I also write in my first book, Core Competencies, about how I believe my withholding from my patient was very damaging to her. And I was being unethical. I was doing harm to her. Yeah.
Yeah. No, I love that, Roy. And I think to your point, um, especially with Buber's model, I think there is a way that we can maintain the master regulator position, but also have a good chunk of us moved by what's happening in the here and now. You know, that's like,
Hmm.
what is it about how I am with you that is evoking these feelings? And perhaps we can explore what's lacking in your relationship. And I think for therapists listening to this, Roy, that perhaps have come from a more cognitive background or, you know, it's very sort of treatment heavy, but really want to move into using the relationship as a healing agent, what are some of the ways in which they can start to explore their own experiencing, their own vow, all that sort of thing?
I love that question. Because I want to give Boober a moment here. For him, love is a responsibility of an I for thou, that and in his I thou work, how do we come towards the other as a different other, curious to know and to become a co-participant in a genuine, authentic dialogue.
Mm,
And then he also says it's ethical, love is ethical before it's emotional. And it love carries a responsibility, and that's what I was also talking about with this group, to respond to the other as they are, not as we want them to be.
mm,
That's a big distinction for me. And to refrain from domination or interpretation, and privileging becoming over understanding.
mm,
Um, and that's what I like to think, of course, is that this a relational model uh, transcends all models.
mm,
That sounds very big and grandiose, but I believe that how we are present in that room, regardless of our model, is the change agent.
yeah.
And one of the things I would say to technique-driven practitioners and programs is don't believe in your technique, believe in yourself and
Mm,
believe in the self of your patient. And so if somebody is trying to transition or even if they're going to continue to practice the way they're practicing, don't get so caught up in your technique, get caught up in you and your patient. Then what I believe happens is when that happens, there's something that begins to interrupt you. You heard me speak of the viscera. If you are no longer providing and doing something to someone, all of a sudden you're participating with someone, you're going to have new feelings. And then you're
mm,
going to go, what the hell? Now what? And then you begin to see that, oh, those feelings have something to do with this patient's narrative. Oh, wait a minute, my narrative is also getting evoked. Oh my, the patient's story is trying to get inside of me so that I can participate in their story that I can be open to how it repeats itself. And in the repetition, we begin to do the work. So I think it's almost a natural flow when we stop applying and being.
This is these are the sort of moments that really excite me and then also really scare me because I so agree with you that I'm now sort of wondering what the you know, if someone here were here with us, you actually do this in the book too. You offer a really interesting critique, and I'm sort of reading it and I'm going, oh, I appreciate that it's here. I just can't. I get this, but I can't get it, you know. But for perhaps if someone were sitting with us here and going, you know, I get what you're saying, Roy, but I really do believe in the treatment model. I do believe in the necessity of you know, interpretation, for example, over the relational process. Do you have anything to that for us, Roy? Like, what do you think?
Yeah, I like sure. Um, um, we're always judging, we're always interpreting, we're always yapping. That's what we do. But are we paying attention to what that what goes on with that. So, for an example, I had a patient just 2 days ago who was going to end our. It was. I agree with her. I don't. I think she will be fine without me. The termination would be fine,
Mm,
and she was going to terminate in November, but then didn't, and then said she was going to terminate at the end of January, and then haven't. So I've kind of moved into this termination phase. I guess I didn't even know it. Um, and week before, she says, "Oh, you're back. Where have you been? You're back." And I go, "Wow, where? I don't know where I've been. What have you experienced?" And she says, "Well, this relationship of ours has turned into be more like friends. And today you're being an analyst again."
mm,
Uh, and so why I bring that story up and then uh, she and I then worked with that. What is the difference and why did I do that? I said, I think probably I was saying goodbye and I'd stopped working the way we work normally. So what does that work mean? It means that I am interpreting, if you will. We don't have to throw it out, I guess. But my mind is kind of going, what the hell is going on here anyway? And I'm not tied to my words. The words are simply for us to work them,
mm,
not for them to state that. And interpretations are loaded with a knowing. And I want my words to be involved in becoming.
mm,
And so I want to be really careful that when I give an interpretation, I'd rather say it's an invitation for a deeper dialogue with you, as opposed to this is what I think is going on. So if I say this thing, and whether it's on to anything or not, I don't know, but I say the patient knows themselves best. They just don't know that they know. And they hire us to help them know what they already know.
mm,
Because we're all defending against some intrapsychic trauma, some intrapsychic pain. And so that whole again about the defensive structure, it defends against that pain. And so it's there. We all know something in our gut about ourselves that we're not paying attention to. And psychotherapy pays attention to that. And I think that's best. Like I remember early in my career meeting people who had been in their analysis and they had great insight, but they weren't great people to be around.
yeah,
They knew themselves kind of, but they hadn't had an experience of themselves. And that's the only way I think that can happen is if we show up. I wanted to say a couple of things. I could go on and on, but Winnicott says this, it appalls me to think how much deep change I prevented or delayed by my personal need to interpret.
mm,
If we can wait and directly engage, the patient arrives creatively to themselves with an immense joy. And I now enjoy more than I used to enjoy the sense of having been clever.
mm,
And you'll also see in my courageous speech chapter where I speak of a psychologist I was working with, and oh, I had this great interpretation. Oh, I was so clever, and I could hardly wait, was hoping he'd shut up so I could, show
yeah,
off.
that's it.
But I caught myself and I go, oh, wait a minute. That's all I want to do is I want to show him how smart I am. And so I stopped and I didn't. And he came up with everything and more about what I had in my mind. And
Mm,
it, of course, landed with him then, right, in a way that my interpretation wouldn't. So I say to directly get back right to your question, we're always interpreting when we open our mouths. Um, we're saying something about the story, but my whole thing, and this is where I can go a little bit into self-disclosure, which is a big talk in our field,
mm,
is I really think more about relational disclosure. So are my speeches, are my interpretations, are my words attending to that which I'm experiencing and growing with in the narrative of my patient?
mm.
Um, and so interpretation, yeah, but so what?
Totally. Yeah. Yeah.
Yeah.
And it also, I mean, your point about, and perhaps we can start get into the competencies now, but um, coming back to this, I'm really excited to read this paper as well, Roy, around the ethics of uh, non-disclosure. or the unethicality of it. Um, as we know, as soon as you walk into the room, you're telling the client something about yourself. I've got a shaved head, I've got a beard, I've got tattoos all over my body. I have a sort of way, a cadence, a gait, like all of us, and it tells you something. And I think what's even really striking, and again, why I really feel like you've given me the words to actually describe how I can't help but be in the room with someone, is that to not do that pulls me away. It objectifies them. I think about the Buber quote, through the thou, I become I, and how selfhood emerges
Mhm.
between, not within. It
Mhm.
as soon as I read this, it was like the dam had broken for me, and it was okay. Now there's research on it. Oh, thank God, because here I am thinking, oh my
Mhm.
God, I'm just trying to create authentic relationships with people, and I'm not doing my aloof intellectual thing like I should be because I have this
Mhm.
degree and all that sort of
Mhm.
thing.
Mhm.
But
Mhm.
so important, and the point that I was going to make there, I think the irony of this, especially when you do a master's program or a bachelor's program, is, what are the most foundational principles that we all learn as therapists? They're the Rogerian principles. And one of the main principles, if not the main one, is congruence. How
Uh-huh.
incongruent is it of us to hold back our feeling and interpret it? It's written all over our body.
Mhm. Mhm. Exactly. Yeah. Yeah. Did you ever see the Gloria tapes? They
Yes.
probably,
They
yeah.
they actually make me cry, Roy. Every time, at the very end when Rogers is working with God, I can't watch that without getting teary because it's so beautiful.
Yeah.
Yeah.
There's two things about that. One, so, it's interesting how people evaluate and do things and all that sort of thing. And so people would criticize him or whatever, or I
Mm,
might, like empathy is not enough.
mm,
But
mm,
I remember watching it the last, because I would assign it to my students as well. And I thought, wait a minute, this man is fully there.
mm,
That's what we're talking about. And then he and Booper had quite a conversation. And so of course I tip over to Buber again, where Rogers was talking about affirmation. Buber talks about confirmation,
mm,
and my work is about confirmation. And I would say that the issue of the Rogerian approach is he was deeply not just encouraging you and all that sort of thing. He was feeling her Gloria in that particular tape in a particular way that felt really good, right?
yeah.
But what I also know and where I appreciate Buber is confirmation requires more of me and it also has more authenticity to it. Affirmation
Mm,
can trend to being the good object, being the good analyst, being the nice guy, the person that they never had in their life, and now you're it, and all of that confusion around that. Where confirmation involves the whole affective states, I believe, of myself and of the patient.
Do
Yeah.
you, just on that, do you think that, because I remember reading A Way of Being, and Rogers doesn't seem to touch too heavily into Alan Shaw's work around the right brain to right brain stuff, the enactment stuff, the regression stuff. Do you think that, I mean, it's an impossible question, really. I'm just interested to hear your thoughts. Do you think that if Gloria and Rogers had continued to work together, there would eventually be a, because there's an obvious transference around the good father there, beautiful and a really
Mhm.
beautiful moment. Do you think there would have been that? I suppose what I'm asking is, are the enactments and those necessary regressions back into those attachment injuries, are they a natural consequence of a way of being? Doesn't feel like something that you can push into the relationship. It's more something that occurs. Did you agree with that?
Uh-huh.
What do you?
I do. I do wonder, though, and especially because of how I see the results of Rogerian ideas in our field,
Mm.
is that Rogers needed Fritz Perls to do the hard work. And Fritz needed a little bit of Rogers
Yes.
to do the other side, right? Um, that it is an emergent thing. Like this also is about people wonder about or question and always have feedback to me about courageous speech, about being bolder in the therapeutic space. And they had this idea that I'm from day one telling something to the patient, and I'd say, I know nothing about the patient on day one. All I know is that we're beginning a relationship, and our conversation becomes a evolution. Um, and the patient helps me learn how to their language, how to speak, and they
Mm,
learn mine. And in that rhythm of the two of us finding our language changes and increases over time. Now, would Rogers uh, have done that? I don't think so, just based on
mm,
how it's shown up in our field, where I
yeah.
think he would have stayed in the empathic, affirming mindset, if you will, as his technique.
Mm,
Um, but I do believe, my sense, like I said, there was something really sweet and genuine about him. I don't know what he would have done with serious conflict. Uh, I don't know. We will never know. But
yes.
and the conflict model in relational psychoanalysis has moved to not only include the intrapsychic but the interpersonal. And the line is, if there's not conflict in your psychotherapy, has the psychotherapy occurred?
Yeah.
And I would say no.
Yeah. Yeah, I love that. I don't know how you can have a truly corrective emotional experience and even, an iterative one. Doesn't mean we have to dive right into the worst thing that happens on day one,
Right,
but just
right.
slowly. I mean, I suppose that aligns with the notion of repetition and working through. Anyway, let's dive into some of the core competencies here, Roy. So just want to make mention that your lecture series, which from memory, Roy, it's the is it the Institute of Relational Psychoanalysis? How we find it on YouTube?
I think if you go Roy Barsness, you'll find it.
Yes.
And
Yes.
you can get the whole playlist. There's nine videos. And so you can put my name in, or you can put in create core competencies in relational psychoanalysis. Those are the two. Yeah, core competencies. The name of the book or the name of the author, and
Yes. Yes.
it'll get you there. And
Totally.
look for the full. It'll say under one of them full playlist, and then you can
That's right.
get them all.
Yes.
Yeah.
I'll make sure to put that in the show notes so that people can just easily access it. So 7.5 core competencies here. Can't talk about them all. If you want to dive in and have a listen to them, check out the YouTube playlist that we discussed. Which is your favorite, Roy, or which is most special or most important to you? Which moves you the most?
hmm Well, the first thing I would say is the one that's actually not in there.
Love it. Love it.
And what I in my new book wrote a chapter on. It's called The Essential I. And it's
Mm,
everything you and I are talking about. That um, my we have to begin with how essential it is that the presence of the therapist is present.
mm,
And so much of us, and it's easy, like obviously my patient told me the other day, where did you go? I was not there. And she said, you need to come back. And then she told me yesterday too, she said, and I expect you to be my analyst all the way to the end, no matter when I terminate.
okay.
And I said, yes, because that's what I do here, but it's also when I'm most present to her, right? And so she reminded me of my own essentialness, if you will, and the idea of essentialized. So my favorite, which isn't in the core competency book, is the essentialness of us showing up,
Mm,
and the terror of that. Like
mm,
when I, in my certificate program, and when I encourage people to think that their subjectivity is key to the therapy, it is such a major shift that it has a terror to it, if you will, sometimes. Like, I don't know if I can bring myself in that. Because we're good at hiding. And I don't even mean that in a negative way. We we were formed in a way to protect
mm,
rather than to be present. And so that's my favorite. What I would say, um, which actually, in a way, I have talked about it, but I would talk about it even more strongly, which is the therapeutic stance attitude, which is this radical openness to oneself. So, again, the chapter 4 in the new book speaks about the essential I, and we are taught, right, in our programs to be radically open to the other. Well, I say, that's pretty hard to do and it's not for real.
Mm,
Like all of us are judgmental. And so every patient, the life they have, I've already made a judgment about it.
yes.
So what am I going to do about my judgment, right? And usually my defensive structure is I can't be open to my own structures, my own traditions, my own culture, my own way of being in the world is my way of being in the world. And to rip that open by somebody who's different than me, but that it is the stranger that is within that we have to play with. And it doesn't mean um, that we're all the idea of being well analyzed is that's a work of a lifetime. But always am I at my best open to being infected and to be and am I open to then play with it when I'm not? That's what I mean by radical openness to oneself. Can I play with all of these multiple affective states that
Mm,
emerge?
mm,
I would also say so that's a big deal. I also have been pleased to introduce the idea of psychoanalytic therapeutic intent because every model except psychoanalysis knows what they're doing.
yes.
And
That's
so
awesome.
I would say we better know what we're doing. What
Yeah.
is the purpose of us sitting for years together? And uh, and so it was fun to see uh, some of the things that came up that our work should produce such and such.
Mm,
And
mm.
that so I was glad to introduce, like, really think about it, like I did with my students. What is your North Star? Why are you doing this? Because we get lost all the time in the work. And my patient reminded me the other day to think, why are you doing this, Roy? What is your therapeutic intent sitting here being social with me,
Mm,
ha-haing me, instead of thinking me and being with me and working with me? And so our one of the goals is to help my patient become radically open to themselves, to be able to play with all of their multiple affective states, to be in deeper relationships, to be more imaginative, to love. Um, so that I think that's a really important one.
mm.
Um, the other thing, what's really powerful to me, I guess I like them all, but I want to say I think the courageous speech is really important to me
Yeah.
because I see with my supervisees the how we stumble around bringing honestly something that is occurring in the treatment, which also applies to how important we are radically open to how we're getting caught up in the story and how we might be colluding in the story and how we're going to work that. And, I'm not successful with all of my patients. And that really makes me stop and go, what have I done? What have I haven't done? What was in the way? Because yesterday I was supervising someone and they were saying with the patient, um, like the treatment failed because of the patient. And I said, I don't think that way. When
Mm,
when a therapy fails or we're stuck, I go, yeah, this patient's narcissism or their borderlineness or their whatever. But what about mine?
yeah.
Um, and how am I got caught up in something I couldn't find my way out of?
Mm,
And in fact, this patient I write about in the core competency text in the courageous speech chapter, I believe, and she diagnosed herself, and I was not in disagreement, and she was a classic borderline out of the DSM.
mm,
But I was more borderline than her many
mm,
times in that work. I was the one splitting. I couldn't bear her. I couldn't bear the emotions that were going on. And so this idea of repetition, working through conflict, having the courage to speak to it, considering I think that Jessica Benjamin has given us so much around the concept of the third.
mm,
Uh,
yes.
so and I think the last thing I would say, the deep listening affective attunement is a listening to that which is not being spoken, to the viscera. And I write in my new book, there's certain people who hit us, right? And we go, yes. And when I was reading um, Erwin Singer one time, and he said, you've got to pay attention to your viscera. I go, ooh, viscera. Yeah, that's my word. and it's never left me. So that effective attunement is trying to get beyond the noise of our words, my own and my patient's words, to go, what is the motivation and the affective states that are bringing these words to the fore?
That point about the viscera, Roy, I'd like to spend some time here and delineate if you think that's necessary between what someone says. What you hear explicitly, and I'm reminded of Peter Wilberg's book, the Heideggerian model of the therapist as listener. That really helped me too. With he speaks about how there's, really what we mean is what we don't say through the word, the dialogue, the dialogos. I can say, for example, yeah, today was a good day, and underneath that. But do you think there's a difference between the felt sense and the emotions that are evoked? I know there's a bit of nuance to that, but when you talk about the viscera, is that something that's a little bit different to simply naming the emotion for you?
Hmm. I'm going to take your question in this way,
Mm,
um, and tell me if I'm getting to it. When I think of the viscera, another thing I want to be clear about, I guess, is that everything that comes to my mind doesn't come out, right? Um,
mm,
and every feeling isn't expressed. Um, but I'm trying to, when I use viscera and affective attunement, I'm trying to not let my head win.
mm, mm,
I'm trying to stay in an affective, attuned way.
mm,
Um, so that's my driver. So what I say is affect precedes cognition. But what happens, the mind takes over so quickly. Like you felt something and I felt something for you before we even began, but
yep.
then we got to thinking, right?
Yes. Yes.
And that's what happens in therapy too. The patient and I are both infecting, to use Bolus's term, and and our affects are being spoken to, right? Like projection is considered a communication rather than a defense, if you
Mm,
will.
mm,
Um, that there's something felt before we think, but our mind is so powerful.
mm,
And so when I talk about the use of affect or the use of the self, it basically is saying, am I attuning and organizing my time with my patient affectively without knowing that my mind is going to do all of its stuff, it's going to formulate its words, it's going to do et cetera, et cetera. But am I willing, as Bion says, willing to be not willing, but how we need to metabolize, how we need to digest and let it work in us. And so I don't know if I'm answering your question on that, but that's my idea there that it's not a blurting out all the time of
no.
affect. The affect is the driver.
The way because I think in images and I have to find the words to do it. That's why I really
Hmm.
like words because I tend to get lost in here a little bit. But what I was imagining there was it's sort of like, and it probably aligns with the concept of the third too, that when you're speaking with someone, it almost feels to me, Roy, and I'd be interested to hear your take on it too. It looks like a mirage. Like if I was in a desert and I saw an oasis off in the back, it would be very sort of blurry and to some degree sort of transparent, but a little bit opaque too. And I really need the client's words. Like if I've got one piece of the jigsaw puzzle, they've got the other to bring that to form. And that's why I'm so happy that you wrote this book and why I'm so far away from the healing agent as intrapsychic because I don't understand how a that mirage or whatever that nebulous truth is um, can be given form and can be named without the social constructive dialogue. That
Right.
that's what it is for me. Yeah.
That's exactly, and what a great metaphor because the mirage that's the danger of interpreting it as though you can see it in its totality.
Mm, mm,
And we can't. It's an approximation. It's an almost, but
mm,
not quite. And so like with Bion in his work about the metabolization, I love that concept, but it always stayed with him
Mm,
before. I can't say that about him, and I have so much deep respect. But I'm saying the metabolization idea was the therapist's responsibility to metabolize that mirage, if you will. In the relational movement, it's the metabolization of the therapist and the co-metabolization with the patient,
yes.
and that's what your metaphor tells us, which is a wonderful one.
From that, how far do we go before we start moving into a sort of forensic type model of
Mm,
co-analysis? When I was reading about forensic, my wife is also a therapist, and I was sort of thinking like that feels more aligned with how we are in our relationship, because
mhm,
I'm
mhm,
not the master regulator, she's not
mhm,
we just sort of being with our unconscious and growing together, and that feels more like a personal love. Do you make that
mhm.
distinction? What's your take on that?
It's a great question, and I only have the gossip of Ferenczi basically in my head. I haven't read him. I mean, he's influenced the relational movement in a very big way.
Mm,
Uh, but so in my limited response, um, I would say your wife or a friend. Like I
mm,
think this one friend of mine. We talk very intimately about our lives and about what we think of the other and all that sort of thing. Um, but such a different kind of discussion.
mm,
Um, but it's psychologically fruitful, right? It helps. But with family and with friends, I find that I just don't have I don't, I'm thinking differently to begin with.
yeah.
Then the second thing is, I remember when I was first starting my first job, I met this priest who was also a biker and a skier. And so we became friends. And I would always call him Father Andy. He says, Roy, just call me Andy. I said, are you shitting me? I need a priest in my life. You are Father Andy to me.
Yeah.
And it's the same thing. Like my patient said to me, be my analyst.
Mm,
And there's an asymmetry there that allows for me to not have as much maybe self-conflict as
mm.
I'm being I shouldn't, I don't conflict, agenda. Like with you and your wife, you have an agenda in a way that's different that you have with your therapist. And
Yes.
that's the asymmetrical relationship that I think we have to always attend to.
That's awesome. Yeah, the agenda is just totally different because I've thought about times when I've sort of disclosed with clients and I've spoken more about content perhaps than process. And here I was thinking this would be hopefully helpful. They were just quite bored about it.
Mhm,
It wasn't even a, oh my God, you're a person. It was like, great. But it's always seemed to me to be the case that process and how they've made me feel as opposed to what's going on in my life has been more important for them.
mhm, mhm. Yeah, yeah. Content and advice usually falls flat.
Yes. It's an important little sticky note, I think.
Right, exactly, right. Yeah.
Totally.
Yeah.
Roy, when you're working in the here and now, what are some of the things that you're looking for? I know we've sort of touched on it. I'm heavily influenced by Irvin Yalom as well. He's someone who's also really helped me give voice to the way I really like to be in the room. And obviously he very much loves here and now. In fact, this is an Irvin Yalom stack right here. Um,
Oh, nice. Yeah,
yeah,
he's been very successful in challenging good things in our work. Yeah.
exactly. Yes. But
And you know why? You know, the thing is, I really believe again, and I hope to be this person too, is his work moves you into the relationship
mm,
in contrast to the technique, if you will. Um, and and that's honestly, the more that we can develop that presence, that capacity for presence, the more I believe all therapies will benefit.
I'm going to dart and speak about that actually, because I this is why I think existential psychotherapy has helped me so much in my life. I read all of that for me. it ended up being useful with clients. But I've never quite understood the notion. I mean, I get it to some degree. Um, that you want to be a therapist. I'll speak about myself. I don't want to speak on behalf of others, but I moved into therapy because I was really struggling in my early 20s, with my own mental health issues. I wanted to be an AFL player, like an NFL star if I was
Nice.
American. Oh, you've been to Melbourne, right? Um, it's like a religion here. Um, and
Ah,
it's massive. Yeah, and when I was able to move beyond my own defense and recognize that I just wasn't good enough, then my sense of identity fell through, and
mhm, mhm,
Heidegger became really important for me, and OCD emerged as a defense to all of that predicament and that sort of thing. So therapy for me has always been about trying to understand myself, and then when I started reading Yalom, it felt like there was a way to be with others in the most real way that you could be with others. And a true, authentic relationship for me, Roy, and this is why I've been so moved by your work, has always been my buffer against my existential predicament. I'm just
mm.
sort of floating on a ball here. I'm going to die. That's kind of scary. I'm a being towards death. But we have this moment together right now, and this is beautiful. And you don't present a mask to me. I'm not presenting a mask to you. And so it's always been. I've always felt kind of selfish, from being a therapist in that way. And I think hopefully as a positive externality, it's helped some people too. But I I don't know. Do you resonate with that? What's your stance on the selfish aspect? It's quite strange to use that word, but how it moves you when you get to perform your therapy and be in relationship in that way.
Mm. Wow. I guess my response to that is being human with another human being never feels selfish.
Mm,
Selfish would be to me, um, what would selfish be to me? If I was only taking, if I was only using the patient for my money, for my benefit, for my esteem, that that would be dreadful
mm,
and unethical. But I like to think that I practice out of the discipline of showing up in such a way that I am calling forth another human being as well. I'm going to read you something I wrote in this. I don't know, maybe it might fit
mm.
to your question that I wrote some time ago and then included it in the preface of this new book. And it says this, if you don't mind.
Please, yes.
Someone once asked me, "Why do we do this for a living?" I answered, "Because to us, to do anything else would not be living. For who else is granted the sacred gift of tending to another person's tattered and broken soul? Who else is called as witness to discover the depth and beauty of a person when they or others can no longer see? Who else is called to listen to all that has been left unsaid, seeking voice? Who else is called to become entangled in the story so that a new story can be written? And who else discovers their own soul when they've touched the soul of another? Why do we do this for a living? How can we not?"
Mm, exactly. Exactly. Yes.
I think that addresses the selfish question, I hope,
Yes,
where
definitely.
if we're doing it well, it's a sacred act of working together. There is always the problem of being paid, of all
Yeah.
those kinds of things, but it's how we show up in that room.
Mm, mm,
And when two people show up, it's a touching thing. It's a sacred moment.
yeah. Beautiful, Roy. Thank you. Yeah. Who else? I love that. How can you not?
Mm,
How can you
mhm,
not want to do
mhm.
this? Exactly.
Right, right.
What are you hoping? I haven't read your second book about the how this all relates to supervision. I'm excited to read that. But What are you hoping people take from this podcast and from your work and from your future endeavors? What's the big message here?
Hmm. Well, first of all, I want them to know that you're a great interviewer, and it's been fun to talk with you, and your energy is very compelling. But maybe I can boil it down to two things. One is we have, I think, really talked a lot about the primary agent of change, which
Mm,
is the self-therapist, and that um, if you can take away that that really matters, that you really, really matter, and in mattering in that way, it invites the other to come forth and to create a new capacity of their mind to grow. That said, I do feel like the competencies themselves are a good skeleton, if you will. In other words, they're disciplines, they're not techniques. That if you can begin to imagine that you know why you're doing what you're going to do, that you are going to be radically open to yourself and to the other, that deep listening involves going beyond the cognition, and that affect precedes cognition, and life is going to repeat. Like Eduardo Galeno says, no history is mute, no matter how much they own it, break it, and lie about it. Human history refuses to shut its mouth. Despite deafness and ignorance, the time that was continues to tick inside the time that is. I love that. And when people come to see us, if people can understand, a therapist can understand, repetition is just going to happen. I had
mm,
a colleague ask me the other day, she's like, I feel that um, my friend, in all of her problems with her son, just projected all her shit on me the other day. And she said, "Well, I don't know about that. What about that?" And I don't know what to do, whatever all that was. And she said, "So I feel it's so unfair." And I said, "That's really interesting. I just assume projection. Like we're all just projecting shit onto somebody all the time and back
mm,
and forth." And
yes.
that helps me go, okay, that happened. And now what do we do about it?
Mm,
And so the there and then and the here and now and the defensive structures that show up in both of us, et cetera, come together. And we should expect that. So to answer your question to the listeners, it just cannot not happen.
mm,
Repetition just happens. And how do we then link and pattern and wonder about those things, not only from the past, but how it's happening in the room
mm,
and how it's happening in their life, and begin to then find our way into the encounter with the other, and that if we are to bring ourselves fully, there will be conflict,
mm,
and that we will use that conflict for growth rather than for, oh, I'm sorry, or oh, I must have missaid, or I must have misrepresented. All that might be true or it may not be true, but we want to be more into the conflict and working it out. And to do that, we have to sometimes be pretty courageous in our speech.
mm.
So I think the structure, um, every hour is different than the previous one. So I can't say do this. I can say this is the kind of metabolizing mind that this book offers you.
Love that. And it really does. And I will say as well, so I have a Word document. Usually when I'm reading a book that I'll probably end up using in writing, I will it's when the book is really important to me, I won't dog ear the pages because I want to preserve it. And this was one of those books, just to let you know, Roy. There isn't
Uh,
a single
uh,
dog ear
uh,
page here. But
uh,
I've got a 7 page document, 2,000 words of quotes. On my computer. And one of the most important aspects of this book that I always come back to is the categories or the dot points that you gave about the actual purpose of this. And you've sort of spoken to this throughout our podcast, but being able to accept multiple affective states or multiple selves, how important is that? Taking responsibility, having a more imaginative, creative mind by the end of it. My personal favorite is being able to accept and tolerate ambiguity, coming to a
uh,
place of I don't know. And I always think of the image of, a client initially presenting to therapy, and I can think about this in my own therapy as well. But I had a specific a problem that I wanted to solve in the beginning. Like I'm
yeah.
in the whitewater rapids right now. Help me get out. And as I
Hmm.
continue to flow down that river, I'm shot out into the wide bay and into the ocean, and there's no problem to solve, but there isn't necessarily a North Star to move towards. I'm in this lovely state of I don't know, and it makes me think of Joseph Campbell's quote that the psychotic drowns in the same waters within which the mystic swims with delight. So if we
Hmm.
just spend
Hmm.
enough time there, there's a sense of but it's not that the problem has been solved, coming back to the limitations of interpretation. It's that my relationship to the problem doesn't make it a problem anymore.
Right, right, right. Exactly. That's very nicely put. Yeah.
Really important.
Which brings me to something I like this quote from James Grodstein, who was analyzed by Bion. And one day he said to Bion, he said, I understand. And Bion says, understanding must not be allowed to proliferate. He says, he impatiently replied, if you must, circumstand, peristand, or metastand, but please try not to understand. Because understanding, again, is what gets in the way of becoming.
Mm,
And like you said, the relationship, the solution is how you are relating to the problem.
mm,
And
mm,
we always want to fix something as opposed to grow from something.
mm. Yes, if I know you, that precludes further learning about you. So
Exactly.
what am I doing? Yeah.
Yeah. And
Um,
that knowing has a period to it.
yes. Yes,
Yeah.
exactly. Oh, beautiful, Roy. Well, thank you so
Mm.
much once again. Honestly, such
Yeah.
a pleasure to read this. And yeah, like I said, it's really, really helped me in my own work,
Mhm.
professionally, but also personally too. I think
Oh,
I honestly feel like I'm a better person, for just recognizing how to be more congruent and look at my stuff with interest and curiosity.
yeah.
And it's been really, really helpful. So thank you.
Mm. Well, thank you, Tom. And I can see why you're successful in your work because you have a distinctive and inviting presence. And so thank you for letting me be on your podcast. It's been an honor.
Oh, thank
Thank
you,
you.
Roy. Definitely. That means a lot coming from you, honestly. And I'd love to have you on again as well. I know the listeners will get a lot from this, and there's so many more things I'd love to talk to you about too. So,
Great. Great. Okay. Well, take
beautiful.
good care.
Thank you so
Okay.
much, Roy.